మ్యూట్ చేసుకుంటున్నాను.
మాట్లాడే వాళ్ళు ఏంటి మ్యూట్ చేస్తారమ్మా?
Lakshit sir, can you mute everybody and enable it only when they are speaking, please?
Yes, taken care, madam.
Mr. Vinayak Joshi, have you joined? Are you there? Prakash sir, are you there?
Yes, Abhinandan, I have already joined.
Yes, Prakash sir. Thank you, sir. 2 minutes. I think Vinayak is joining. When else is joining, we'll start the
No
session.
issues.
Thank you, Prakash sir. Bensi? Bensima, are you
Yes,
ready?
sir. Yes, sir.
Yes. Amrita, are you ready?
Yes, sir.
Varshama, are you ready?
Yes, sir.
Yes. Lakshit sir, are you ready? Manjulama, are you there?
Yeah, I'm very much there,
Yes,
Abhinandan.
yes.
I think Rakshit is busy with the technical thing. We'll get started, Abhinandan, please.
Just a minute, ma'am. I think Mr. Vinayak is joining now. 2
Okay.
minutes. Just a minute. I think it's exactly three now. We'll start in another minute. Huh?
Yeah, exactly. Fine.
Actually, sir,
Yes, sir. Yes, sir.
uh, in the Prakash sir is there. You can make him co-host also.
Yes, sir. That is being done actually.
Dura Prakash is there.
Yeah,
DORAPRAKS.
done. I have already done.
Yes. Mr. Vinayak Joshi, are you there? Yes,
No,
join.
sir.
Sir, namaste. Mr. Vinayak Joshi, namaste. Rakshit, we can make him admin there. Post. I think
Done, sir.
Vinayak Joshi has
Done.
joined. Okay. So, Bensi, all set to go. I think we are ready.
Yes, sir.
Yes.
Transformation and change are a natural state of any growth. To achieve sustainable growth, actions have to be derived through innovations and collaboration. Innovation through collaboration is increasingly being considered as critical success factor, and collaboration is the focal point that are valued in terms of growth. To give us more insights on innovation and collaboration, we have eminent panelists with us. I would like to welcome all the panelists. Mr. D.P. Prakash, Joint Commissioner, Commercial Tax, Government of Karnataka. Dr. Jitendra Kumar, Entrepreneur, Health Professional. Vinayak Joshi, Cine Actor, Social Entrepreneur. Dr. Batani Raghavendra Rao, Academician Professor, Jain deemed to be University. Dr. Bidu Kanti Das, Assistant Professor, Mizoram University. Dr. Abhinandan N, moderator for the session. Now I request Dr. Abhinandan to take over the panel discussion.
So very good afternoon to all of you, all the panel members. Before I start, I would like to tell a few things about it. India is going through a transformation, whether it is in the sports, politics, education sector, or entertainment or cine industry, what we call manufacturing, agriculture sector. Most importantly, today, because of the pandemic, healthcare sector too. When we talk about healthcare system, it's going through a massive transformation and itself. Most importantly, we will all see the transformational leadership. That is what I believe in. On this, I would like to welcome all the panel members. It is indeed a privilege to have all the panel members. I'm sure in this panel discussion, we will transform our ideas, help us to innovate our thoughts, and collaborate among ourselves. So let me introduce Mr. D.P. Prakash. He was an academician and presently is an administrative officer. Prior joining Karnataka Public Service, he was worked in Jain University. Presently, it is called Jain University. Earlier, it was Jain College. He has served in the various departments, Commercial Tax Department, served as a Joint Commissioner of Commercial Tax Administration, DG STO2. He also served as a Chief Accountant Officer of the Department of Social Welfare, also a Private Secretary to the Honorable Ministry of Government of Karnataka. Presently, he's working in the Executive Director of Karnataka State Industrial and Infrastructure Development Corporation. He is a political analyst. His love towards writing various articles, and he has published more than 2,000 articles in a reputed national and regional newspapers and magazines. He has given numerous public lectures on various occasions. He has been a true leader, inspiring a young mindset. We are very happy to have you with us, sir. We welcome you.
Thank you, Abhinandan.
Thank you, sir. Mr. Vinayak Joshi is an Indian film actor, childhood actor, a former radio jockey, former head of the digital communication Flipkart, hosted many reality shows and IPL. Presently is head of the production of cult film and independent filmmaker. He recently acted and produced a web series called Josley. I think he's been a true inspiration to the young generation. We welcome you. We were very happy to see you here. We welcome you, Mr. Vinayak Joshi. You have to unmute yourself.
My apologies. My privilege to be here today amongst these eminent panelists, and thank you, Dr. Abhinandan, for having me over here. MLAC is not new to me, but the subject is quite new to me, and I'm quite honored to share the stage with so many eminent personalities. Looking forward to the discussion. Thank you so much.
Thank you, Mr. Vinayak Joshi. Dr. Jitendra Kumar basically is an MBBS doctor. Today he is an hospital consultant, healthcare business analyst, healthcare financial analyst, and strategist. He also helps young entrepreneurs in setting up hospitals. He's been mentor to many people to achieve the targets much earlier. He's been a tremendous, experience in the healthcare industry. In this pandemic, we are realizing how important the health and the wealth. Thank you, sir, for being part of this program and accepting our invitation. And we are very happy to welcome you today.
Thanks a lot, Mr. Vedanta.
Dr. B.R. Rao, popularly known as Batani Raghavendra Rao, professor in CMS Business School, Jain University, a specialization in finance, having a diversified career comprising industry, academics, and research experience. He has guided a PhD in He has a guide of a PhD in management, Jain deemed to be university. He is a successful guided 3 PhD scholars and 3 MPhil research scholars. He has published various articles in a Scopus, UGC listed journals, peer reviewed journals, published books. His area of interest is specifically in finance. He has attended various international national conferences, seminars, adding to his profile. We are very happy to have you, sir.
Thank you, Dr. Abhinandan, for having me, and greetings to you and greetings to all my co-panelists. Thank you.
Thank you, sir. Thank you. Professor Dr. Bidu Kantidas, as an assistant professor from Department of Management in Mizoram University. He has more than 16 years of academic teaching experience. He also has a amount of good industrial experience. He has published various books, articles in Scopus, peer-reviewed and UGC listed journals. He has attended various international conferences, seminars, workshops, adding to his profile. He represents the northeastern states, a very adding to special feature to this. We are happy to have you, sir. Unmute here too, sir.
Yes. Good afternoon and namaskar to everyone, especially Abhinandan, then principal of the Maharani Lakshmi Ammanni College, and all the panelists. And it's a great privilege for me that representing Northeast India in this great panel discussion, seminar. Thank you to all.
Thank you, Professor. Let me start my panel discussion. We have a 390 and there might be a couple of panel student, research and academician, industry delegates might join in time. So we don't want to waste time. I'll keep my time schedule tight so that I can able to cover maximum in a discussion of this. Before I start my discussion, I want to be very clear that this panel discussion is not a political motive, nor we represent any political party or agenda. This discussion is purely academical perspectives, and this discussion will help us to integrate our approach, not representing any political ideology. So we are talking about academical point of view. So you can share your experience, knowledge to enrich our thoughts so that many people are here aspiring to become whatever their life in whatever they want to be in life. So I want you to inspire them. So that is what this discussion is all about. So with this, a quick round of each panel members, they can speak about with respect to streams, how the transformation and the change is taking place in the respective organization. I would start from DB Prakash. He can talk about, what is his organization is all about presently you're working in, and what does it do? How does it bring a change and transformation in India? So that is my question to you, sir.
Thank you, Abhinandan. And thank you specifically for your disclaimer, which has infused a lot of degree of freedom for us to speak, without any reservations. Thank you for the disclaimer. Good. I don't know. I mean, it's so coincidental that KSIDC is in the crux of what the subject you have selected. Specifically, Karnataka State Industrial and Infrastructure Development Corporation is into creating infrastructure for the state of Karnataka. Not restricted only to the industrial. That is why the name is Industrial and Infrastructure. We help industries to go along with creating huge infrastructure facilities, especially in transportation sector. We are building airports. We are building in Shimoga, Bijapur, Hassan, coming up in Raichur, and we are building business parks. So that means trying to create platforms and dots and connecting those dots to put the state on a high pace of transformation and development. I'm glad that you selected this topic, that innovation and the leadership and collaboration all should come together to lift any process of progress to a higher echelon. I congratulate the college management and especially Professor Abhinandan to take an initiative to bring in all experts on one platform and initiate a dialogue. That's a very healthy development, especially in a college like this. The young people have to be exposed to this, and their minds have to be ignited to make it very clear that until and unless you collaborate with right people, progress cannot assume a high pace of development. Very fine. I mean, trying to draw a corollary with my organization where I'm working. I'll just specifically select only one domain, the public-private partnership, PPP. Especially Karnataka is leading as far as the PPP models are concerned. To name one, which has captured the imagination of the nation, is the Bangalore International Airport Limited. Now it is called Kempegowda International Airport Limited, KIL. KIL is the child of the PPP model in Karnataka. KSIDC took the leadership. We had huge land. We collaborated with the people who had the innovative capability and already established expertise and the financial backup. This kind of a synergy between the innovation, the collaboration with different advanced technology, which was so essential to build the airport of that particular stature, with the leadership provided by the government of Karnataka. Now today, Kempegowda International Airport Limited is the third largest, fastest growing airport in the country. And now the second terminal has come up, and second runway has already come up, and we are searching and we are innovating how to lay down the third runway, and then we are going to come up in a couple of years the third terminal. That means it's going to compete with the world-renowned airports. This forges itself as a classic example for any process of creating a synergy between the innovation, collaboration, and leadership. And thanks to the government of Karnataka for providing such a wonderful and stable leadership to bring about a huge transformation in the transportation sector in the state. And you all know how KIL has played a role of a catalyst in transforming a lot of service industries and manufacturing industries in the state, and specifically in Bangalore and around the areas. So what I appeal to the young minds, whether you are into startup, or you are into a kind of a consultancy, or you are beginning to innovate or explore what are the avenues to just make a wonderful livelihood. First, you need to understand that what is the technology needed for a contemporaneous process. This is very important. You have to run every minute along with the developments taking place around the world. So therefore, innovation becomes so essential. So it is actually an oxygen for the organization to breathe and grow. So therefore, you can't simply sit and and try and collect and try to develop on your own, and then again develop leadership, and then again try and accumulate everything and then shot up to fame. No, it's not possible. It will take decades together. That's why when you can connect with the right people who have something which you do not have. I don't want to mention whether it is innovation or leadership. Whatever you don't have, which can complement what you already possess, that kind of a collaboration is the thing for the development which are taking place in the contemporary world. So therefore, if you ask me from the point of view of the government and from the point of view of my organization, what is available readily for the people to forge ahead is the PPP opportunity in Karnataka. And we have a policy which was brought out in 2017, public-private partnership policy, which has laid out very clearly that what all the areas or the sectors which are marked for the private players to come and join our hands. create a synergy and take the progress forward on a very high pace. This is one thing which I would appeal to everybody, including the young minds, to grab an opportunity that here you have a huge platform. And central government unleashed another policy, that is a land monetization. That is again a wonderful opportunity for people to come, especially the warehousing activity in India has subjected itself into a kind of a chain reaction. People are searching for wonderful lands with a lot of connectivity, and government has such wonderful assets. People are coming forward to join hands with the government and create huge spaces for the goods to be stored and ultimately being transported across. So in the sense, it is a very basically a cluster-based development. And apart from connecting with the innovation and the leadership, if you can really find out what's happening and where, and what are the opportunities, and that is one crucial thing for your development. Therefore, seize this opportunity. As a civil servant, I would say that Karnataka is leading from the front as far as this collaboration and providing leadership is concerned, and especially for the people who can wind through all these opportunities and connecting the sources. Here is a wonderful opportunity for you to connect with the government, connect with other people who have the innovation and the leadership capability, and definitely you can forge ahead with a progress which is of higher pace. So this is my kind of an initiative or a prelude to the whole discussion, which is going to be carried over. Bear it in mind. Please go back and read the PPP policy of 2017 of Government of Karnataka. You have a plethora of avenues for the development. Thank you so much, and look forward to have at least this PPP policy to figure in a couple of discussions with the panelists, and I hope the young minds, especially the people who are looking forward to or conceptualizing some kind of startups, will have a lot of things to derive from this sort of discussion. Thank you so much.
Thank you, sir. I think this is what okay. When you talk about the government and when you talk about the so many things about the importance about the innovation and the transformation which is happening. But one more thing before I go to the other panelists, I want to ask you a very important thing. When I look at the government agencies, or a government organization, government is trying its best or trying hard for innovation and collaboration and transformation. But I feel it is unsuccessful in most of the situation. So what is your view, sir?
I'll tell you, I think the point what you are referring to is, I think, belongs to the bygone era. I tell you, a lot of things have been created by innovation and collaboration recently. And as I mentioned in the earlier introduction, Kempegowda International Airport is one such. Which are the things which are in the pipeline? I'll tell you, you will see a lot of changes as far as the Jakkur Airdrome is concerned. We are coming out with wonderful facility for the training of the pilots and the heli-tourism. And all of you are aware of that adjacent to the Kappan Park, we have indoor sports complex. Absolutely. That is being put on PPP model. You will see a wonderful contemporary facility there. And we are creating a lot of sports complexes, making inroads into the suburban areas. Why I'm quoting all these things? Because see, the time is a great teacher. Time teaches you how to change yourself and then make yourself amenable for the trend of the time and the global perspective. And government is not an exception to it. Government also learns and unlearns. Please understand that. And this is a very, after globalization, we are all exposed. I mean, everybody can see what we wear and how we progress. So therefore, this kind of a self-consciousness has infused into us a character to unlearn, which are not necessary, learn, which are very much essential. And therefore, Abhinandan, to comment directly to you, to your observation, I do agree that it was there a few decades back, and there were failures. Absolutely, PPP in the sense it was a kind of a movement did not take as expected, take off did not as expected. But now PPP is the thing. I mean, people are looking forward to have more opportunities in Karnataka, and a lot of things are happening. I am in thick of those activities. That's why I can tell you with a lot of surety that this is going to transform our state. So therefore, providing leadership, government has unlearned a lot of things and learned a lot of other things which are so essential. That is why a lot of people who possess innovation and the financial power are looking forward to have the leadership from the government. And another 2-3 years down the line, you will witness such transformations.
Thank you, sir. My next panelist is Dr. Jitendra Kumar. Today, because of the pandemic, we are talking about health as one of the, without health, without wealth, probably we'll not be able to look after ourselves. So health has become so important. And, how do you see the change, in change and the changes which is taking place in health industry? And what kind of transformation you are seeing in the health industry? I mean, you've been in the industry for a quite a bit of time, and you being an MBBS doctor and being an entrepreneur, I just want you to talk about the health aspects. What kind of a situation we talk about it. We talk about health in the low cost model, low cost healthcare system, but ultimately, where do we stand?
Yeah, Mr. Abhinandan, I think before answering that particular question, right? So I just wanted to, since most of the delegates who are attending this conference are students, I want to run through some of the key things which is currently happening in healthcare, because without the contextual understanding, it may be difficult for students to understand how the economics works in healthcare. So on that note, I have a small a flow chart which I have created just for this conference, and I would like to show that if you permit me.
Yes, please. You can share your screen, sir.
Yeah, I'm sharing. I hope you are able to see that.
Yes, it's visible.
Yes. So just to give an insight into Indian healthcare system, so I would say that the research says that 75% of the people pay for their health from their pockets, and 25% of the people will go for government healthcare services. And in fact, it is accountable to 2.5% of the GDP, which is spent towards taking care of the people, which is a state subject. So public health is a state subject. That means anybody, whether it is poor or rich, okay, they have to get free treatment in the state, whether it is private or government. That is the whole policy. But eventually, with so many contextual understanding and acts, so this has become a kind of a business over these days. So few years back, like you never had an opportunity to know the term marketing department in hospital. Now you can see that one in the last 10-15 years. So just to give that, like 75% of the people who are paying for their health, it will be from insurance or from their pocket. How exactly, whether it is a corporate insurance or a personal health insurance, or paying from their own pocket or the company pays, that's different. Okay, when the hospital take up the responsibility of the state to cover the healthcare needs of the patient, okay, then they have to go through a couple of legalities. Like government do, though their responsibility is to give free treatment, they do monitor in the form of licenses, and any hospital has to go undergo or have at least more than 20 licenses based on the type and type of service and the facilities what they are going to offer. And at the same time, government allows hospital to have an entity under private limited company. That means government is giving a license to hospital to make a business, to make a profit out of the service. So when the government itself is making this provision to hospital, now again they are now capping the price. So this is one of the thing that has to be noted. Of course, like the whole healthcare should not be totally commercial, but at the same time it has to look into so many other cost heads to derive or bring the capping clauses in their norm. Of course, like now there's so many insurance companies, government initiated insurance which are come up, and they have defined the pricing for each of the services. That again a separate discussion to go ahead. Maybe we can do that at a later stage. Coming to private entity as a hospital, so it will be backed up by investors or it will be a doctor's own company. So it will be usually like in both the cases, they have their own set of challenges. And as a business entity, it's their responsibility to make sure to make the entity profitable or at least sustainable, if not profit. So what are they going to do? Define the ways to generate more patient, that is more revenue. Whether it is legal or illegal, that's a different thing. Okay, so we are not discussing about the illegal things. Yes, there are many scope to think on legal way in the form of innovation, collaboration, and with the good leadership, we can make these centers sustainable and then profitable. So coming to another stats which I wanted to show in here, right? So this is not I've just taken somebody who has published this. It's India Brand Equity Foundation which has published. There is a huge market in healthcare which shows that a compounded annual growth rate of around 16.28, which is definitely good in this industry. If you look into here, government healthcare expenditure is also increasing over the last few years, 2.5%. But when compared to other developed countries, it may be around ranging anywhere between 9 to 17% of the GDP. So they are giving more importance to public health compared to private health. But in our case, it is a reverse. So in here also, like government are very proactive to set up more medical colleges and have more doctors to cater the needs of the huge population. The key trends, yes, you can see here, insurance premium is also increasing. That means people are getting to know about the healthcare and are well educated. So government is also, as sir said, PPP. So even in healthcare, government has come up with a vision that to come up with one hospital in each of the districts. So in the form of collaborating with the local existing hospital and leveraging the existing healthcare infrastructure, that is the district hospital, to consider as a teaching hospital. So these are the kinds of initiatives that even government is coming up. So the other one is like, yes, I would like to show this particular. So this is particularly like authored by Soumitra, one of the VC investment firm. So I want to show one point in here, right? So though India is the maximum producer of the doctors, maybe around 70,000 per year, most of the doctors are clustered in urban cities. So if you look into this disparity, urban and rural, so in rural, if there is one doctor, you will see 6 doctors in urban India. So that has given to more challenges, and there is a way, or there is a scope to think innovatively to address these kind of challenges. We have enough workforce not to worry about it, because India is the maximum production in the, and we are also increasing the beds, current hospital beds. So the global beds is 2.6, this is 1.1 currently. And yes, of course, this is old data. We have just crossed to 1.3, something like that. That is not a huge one. But what I mean to say is there's a huge scope and affordability also. People have good amount of money to spend it for their own healthcare. So this is one of the statistical data which I wanted to show. And yes, coming to the last part, yes, as the conference theme suggests, change and transformation through innovation, collaboration, and leadership. Yes. So the 3 major collaborators in healthcare startups includes the domain. So somebody should know what exactly the healthcare. So they should be given more importance because they understand the economics, not the economics, ecosystem of the domain. And then the support services, which may include software, accounts, admin, HR, and then implementation. We are ready with these 2, but we have a special skilled people to take the model to the market. Yes, there is a huge opportunity which eventually we are going to discuss in couple of minutes from now. But the rules of engagement in all these should be, we should have an inclusive strategies. That means like we should not disturb the existing ecosystem. So then there'll be a lot of acceptance of the concepts. Then we should share the responsibilities. Okay, so if IT people take up the responsibility of the scalability, and domain people should take up the responsibility of offering the services, and implementers or the sales or marketing people should take the services to the market. So we collaboratively have to achieve the goal what we had set for. So government formulates new rules for the new services. For example, COVID, during this COVID itself, like earlier to that, telemedicine or teleconsultation was had lot of clauses. So there cannot be a one-on-one patient to doctor consultation with a clause that, okay, there should be one GP doctor on the other side while consulting for the specialist doctor in here. Now it has been relaxed because of the scenario or the condition. So at the end of the day, the project should be sustainable and then it should be profitable. So if you look into the ecosystem, we have all these areas to collaborate. So as of now, right? So most of the doctors have their own clinics. There is no collaboration between the hospital. There is no internal collaboration with the labs, pharmacies, patient care, patient education. So if you start listing, I've just listed few of the things. And if I spend more time, there is plenty of avenues to add to this particular. I mean, we have so many other verticals that can be added to this list. So with this context, I hope most of the students and other dignitaries has understood the healthcare part of what we are talking now. And coming to what you just said about the COVID, yes, there are a lot to discuss on that, and anyhow, like we are going to discuss much more. And one of the key project which has been taken forward was in the community is telemedicine. So Telemedicine Society of India has maybe I think it has structured its process in a span of around 2 weeks and sent the guidance to all the service providers in India to frame up their consultation services based on that one. So this is one of the breakthrough, I think I should be saying, that COVID has influenced the decision makers to adopt these kind of guidelines while offering the services.
Thank you, sir. I think the model was so beautiful, which made us to understand a lot of our doubts, and that is what most of the time we're going to discuss in this panel discussion today. Thank you for that. That was brilliant. Let me go to Professor B.R. Rao. B.R. Rao, Professor, please tell me, why do you think transformation management is so important in education sector? Today we talk about NEP, we talk about technology, and the blended mode of learning.
Sure.
Why do you think it's so important, Professor?
Thank you, Dr. Abhinandan. At the outset, I would like to thank the Department of Commerce, Maharani, Lakshmi and Ammanni College for organizing this wonderful topical conference. There is a national conference on change and transformation through innovation, collaboration and leadership. The theme is very topical and it is a need of the hour. Thank you for having me here. See, as far as the theme is concerned, there are two parts to it. One is change and transformation, which is the need of the hour. And also it was forced on us because of the pandemic and disruption in technology. We have to go for a change and we need to transform. So we are forced to do it thanks to pandemic COVID-19. That is one part, change and transformation. And second part is innovation, collaboration and leadership. These are the enablers. In order to adopt the change, in order to transform the entire society, the entire ecosystem, we need to innovate, we need to collaborate, and we need